Welcome to the Prospective Doctor podcast, brought to you by MedSchoolCoach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hey everyone, it's Dr. Marinelli here. Thanks so much for joining me. Today I have a special guest on, Dr. Stephen Eilers, who is a MedSchoolCoach advisor and has been with us for several years. You may have seen him on some of our webinars before. He has a wealth of knowledge about the admissions process. But today I wanted to have him on to talk about his specialty, which is dermatology. Dr. Eilers, thanks so much for joining me.
Thank you very much for having me here, Renee.
Awesome. Well, so as I mentioned, Dr. Eilers is a dermatologist and actually just finished his fellowship training. So Dr. Eilers, would you start by just telling everybody a little bit about your path through medicine and why you specifically chose dermatology?
Sure. I was very lucky to have a parent in medicine. My father's a physiatrist, and I was exposed to medicine at an early age. I'm also tend to be a very visual person, and I always enjoyed being able to look at things, discern them visually. And I think dermatology has a natural draw with that. I actually have an older brother who performs the same work I do. He's a dermatologist and a Mohs surgeon, which I can go into detail later about what that is. And I learned a lot about the field. I always loved procedural work, being able to help suture. I was very fascinated by it. And what was really captivating about dermatology was the ability to have people that you knew, colleagues in medicine, surgery, struggle for hours to figure out what something might be. And to then have a dermatologist walk in and within 2 seconds of looking at a patient, they could diagnose what was occurring with them without labs, without anything. I think it's one of the more pure visual observation diagnostic fields that exist in medicine, which is very unique and fascinating.
Yeah, absolutely. And I mean, I can tell you from a primary care standpoint, I mean, even though we do receive training on dermatology, there's just so much about the skin that is just so hard to know. And, you have a patient come in, something looks scary, he send him to a dermatologist, and usually you guys say, nope, that's nothing, or yeah, thanks for sending this over, we'll take care of it. It's just such a helpful field. And even a field, I know we've talked about this before on a personal note, that is just becoming more and more necessary and utilized, with the amount of sun exposure and sun damage people suffer from. So can you take the listeners through a day in the life of a dermatologist?
Sure. So I'm going to split this into two separate parts. I'm going to talk about a standard general dermatologist, and then I'll also mention what I do for Mohs surgery as well. So as a general dermatologist perform the vast majority of what is in dermatology, including rashes, lesional derm, such as masses that are on the skin, inspection, diagnosis. They also perform excisions. They'll perform other treatments, laser-based treatments, energy treatments, a lot of medical treatment as well. But a general dermatologist would typically maybe start clinic anywhere at 8 or 9 in the morning. And depending on their work schedule, some dermatologists work for 10 hours a day for 4 days. Some work 5 days for 8 hours in a day. Some people work less, but the average workday for a dermatologist is actually 4 days a week. And you'll then have dermatologists work almost straight through. They'll have about a half hour for lunch, but they'll see a patient roughly once every 10 to 15 minutes. And some patients can be more complex than others. Some can be fairly straightforward, fast visit. Others may require much more in-depth knowledge, history, and physical exam to be able to identify. I think the number of patients that a dermatologist typically sees ranges from can go anywhere from 15 or 20 on the lower end in a day to potentially 50 or 60 or more, depending on how efficient the dermatologist is and the staff, the number of hours worked as well. I think the fascinating part about general dermatology is it's a little bit like Forrest Gump and the box of chocolates. You never know what you're going to get. You could have one person with a melanoma in one room. You could have a person who has a rash they've had since a few years ago since they went traveling somewhere tropical. You could have someone with a rare infectious disease in the next room. You could have someone with a autoimmune condition in the next one. There's a lot of variety and a lot of systemic diseases that present through the skin. From the other perspective I was going to mention is Mohs surgery. So as Dr. Marinelli mentioned, skin cancer prevalence and some damage is increasing. And part of it may be due to tanning bed usage, some behavior patterns, but there's a growing demand for skin cancer removal and surgeries. Most surgery utilizes taking as small as possible amount, or the smallest possible amount of skin from a patient, and especially in cosmetically sensitive areas like the nose, around the eyes, ears, face, neck, and looking under the microscope to see if it's clear. This allows us to keep the wound smaller and the defect smaller, and then ultimately we close these wounds with either straightforward linear repairs. We may use flaps where we move skin, rotate it or flip it over one area to another, or grafts where we take skin completely off from one area and secure it in place on that defect. And typically most surgeons may see anywhere from 4 Mohs cases in a day. Some Mohs surgeons who are extremely efficient and well-established can see 20 or more Mohs patients in a day. But it's very interesting that some dermatologists also mix Mohs surgery with their general dermatology schedule and may see some of those general dermatology patients while they have patients waiting in rooms for surgery. It's a little unique in terms of the process, but there really is something for everyone in dermatology, whether you are more medically oriented with diagnosing, or if you're more procedurally or surgically oriented with Mohs surgery, lasers, cosmetic work, even with Botox fillers and minimally invasive cosmetic procedures.
Mm-hmm. And just a question about Mohs, because from what I understand it too, is it's kind of an immediate diagnosis and treatment type of thing. So
it can be. Sometimes patients will come in with a biopsy already performed, mm-hmm. and then we treat it based on that biopsy. And that's usually the majority of times it's biopsied and then we treat. However, some patients that either it can be difficult for them to get into the office, or they may be coming in from a couple hours away. Sometimes we'll biopsy the lesions and read them under the microscope. And then once we have our biopsy performed, we then will perform Mohs surgery on them. That actually does happen. They're called frozen section biopsies. It's a little, I'm not going to go into the technical details with it, but we're able to process a biopsy in sometimes under 15 minutes from the biopsy being performed and determine the diagnosis and then perform surgery on it.
Right. That is amazing. And it's definitely appealing to some of the people out there that may be considering, like fields where they have, a rapid resolution of problems, so to speak.
Yeah, dermatology is a great field for people who like immediate gratification. Some people may have gone on to Dr. Pimple Popper's or Pimple Popper MD's YouTube page and love the feedback of removing a cyst or seeing the removal. It is a very good field for people who like immediate feedback. But also, if you're someone who does like long-term improvements, there is a lot of work and rewards that can occur from that as well over time with systemic medications that are administered, for instance, such as for psoriasis or atopic dermatitis, also called eczema.
Mm-hmm. Absolutely. So, Dr. Eilers, can you tell us a little bit about kind of the path to derm? If somebody's thinking about it, what should they be doing, in medical school? Even, there's not too much to be doing pre-med, but I think it's still relevant if this
Sure.
is an area that they're potentially considering. What should people, start thinking about?
I think the most important part as a medical student is, even if you have a field in mind, always keep an open mind to all fields. But while you're exploring the fields, let's say that you're a first-year medical student, maybe it's the fall of your first year, and you think you may have an interest in dermatology. Mm-hmm. The best thing to do would be to meet with your dermatology department, get to know some of the people there, and see if there's research projects that you may be able to assist with. It could be something a little more rote or menial. They may ask you, can you help edit some videos for a project that we have? Could you help us track some photos? And it might be what you would call grunt work in the beginning, but you also show your dedication and your help, and you may be able to gain more responsibility. Your department will also get to know you better and understand your interests up front. Mm-hmm. Now, the dermatology is a very competitive field to be able to match into. And I always recommend that performing a lot of research is great, but you will need to score well on step one. The numbers keep going up. I joke around that I think my number each year just looks less and less competitive compared to each year in the future.
Yeah.
I think a lot of people would probably need at least it was around 240 for me to feel comfortable when people were applying. But now I would say it's even up to 245, 250 plus. The numbers keep going up for step one.
Yeah.
That's going to be important to do well. And also to focus on clinical rotations. Usually you'd recommend trying to honor nearly everything that you're on. If you had 1 high pass, 2 high passes out of 7, it's not the end of the world, but it's better to have more honors than high pass and definitely avoid passes. The last part is also going to be on step 2. Some people who score well on step 1 will opt not to take step 2 until after they've applied. Other people who may not have performed as well as they knew they could on step 1 may then try and take step 2 earlier to show they can perform well. There was one anecdotal story. I knew someone who had a high 230s on step 1, not as competitive as they were hoping for. And on step 2, they scored a 280, which is extremely high. Yes. And so that was helpful for them. Now, all that factored together may help you if your school has AOA, or Alpha Omega Alpha. It's the Honor Society of Medical Schools. Not all schools have this, but if your school does, you should aim hard to achieve this because the vast majority of dermatology applicants who successfully match are AOA. It doesn't mean that if you're not AOA, you will not get in, but it makes it much easier when you apply if you have that title.
Absolutely. So, I mean, it sounds pretty competitive, but it also sounds like a very rewarding career. Can you tell us a little bit about the residency as well? I mean, once you get in, what would somebody expect throughout the residency? How long is it? What are some of the, the challenges, some of the benefits?
I think that the path itself is very rewarding. It typically starts with an intern year after medical school. So this could be in medicine, it could be in surgery. Some people choose pediatrics. There's also a transitional year that may be available as well, which combines some of medicine, surgery, and a little more elective flexibility. I pursued a transitional year, and I thought it was very beneficial because I had a month rotation in plastic surgery, a month rotation in rheumatology. I could tailor it more towards my experience that I would have as a dermatologist versus internal medicine. I would have had far more of a medical experience, but not the surgical exposure or the elective exposures.
Right.
But it depends. If you're interested in pediatrics, there's pediatric dermatology as well. That's a great route to go. Now, after your 1 year, intern year, transitional year, there's then a 3-year dermatology residency. And this is typically, can vary program to program, but typically includes various rotations, including medical dermatology, procedural dermatology, pediatric dermatology. There's also pathology, where you learn how to read slides. Dermatology is one of the few fields where, outside of pathology itself, that you actually read your own biopsy slides potentially. We actually have to study this for our board exam. So if you're someone who loves visual diagnosis and you like radiology, you may also like dermatology and dermatopathology, where you look at individual cell types and clues and patterns to help make a diagnosis. Then after the 3 years, there are several fellowships that are available. Most of them are 1 year. There's some very rare programs that are 2 years, but typically the fellowships that exist are dermatopathology, what I just mentioned in terms of looking at biopsy slides, getting specialized training and reading those. There's pediatric dermatology, where there's very rare genetic conditions that have manifestations as children that they learn more about. There's also cosmetic and procedural dermatology fellowships, where they focus on cosmetic work with lasers, Botox, fillers, which are used. They're basically hyaluronic acid they inject into your skin to help plump it. And then there's also Mohs surgery, which I've elaborated on, where you learn how to remove the skin cancers, read them under the microscope. It's similar to dermatopathology, and then you perform the repairs. Mohs surgery is very unique. What drew me to Mohs surgery was that it's the only field of medicine where you're the surgeon and you are the pathologist at the same time. And I thought that was very unique and fascinating.
Yeah, absolutely. That is so great. I've learned so much about dermatology just from this short time. As we close, Dr. Eilers, can you give any last minute tips to anybody that could be considering dermatology or even considering a very difficult specialty like dermatology?
Absolutely. I think that don't be scared if you may not have the traditional numbers needed to get into a field. I took a research year, and I was going to mention that I had a research year between my third year and fourth year of medical school, and I want to be a little more competitive applying. And nowadays, it's almost more common to pursue a research year before applying than not. This is common in orthopedic surgery. It's becoming common in plastic surgery to enhance competitiveness. I think that if you're someone who may not have the highest step 1 score in the world, but you had good clinical grades, maybe that year of research helps you be able to help you stand out as an applicant. Or maybe you really are selective about which city you want to end up in a competitive field, and pursuing that year of research can help you be more competitive and focused in the city you're aiming at for residency. I think that's very important to keep in mind. And also, if you're at your home program, maybe you don't have the 270 step 1 score AOA, but your department knows you for over the years. They know that you're very interested, you hustle, you try and make an effort on research projects. That goes a long way, and your home program may take you just because they know they're getting a good hard worker and someone that's a known quantity. So having a mentor in the field, if you can develop a mentorship or a mentor-mentee relationship with a dermatologist at your medical school, that can go a very long way towards helping you match in the field, even if you don't necessarily have all of the traditional numbers needed.
Awesome. Thank you so much. That's so helpful and definitely gives a lot of information about a really awesome field. Thanks so much, Dr. Eilers, for joining us.
Absolutely. And if there's any further questions, if MedSchoolCoach is happy to, I'm happy to help answer questions about the field. As someone who went through the arduous process and stress of, am I going to get into the field? How is this going to work out? I think I'm very happy to pay it forward and help anyone out who has any questions about it. But it's definitely a difficult journey, but it's well worth it. I just finished fellowship today, and the dividends definitely do pay off. I think it's been great to put in all the work and effort and know that I'll be able to take care of patients on my own now.
Awesome. Well, congratulations, Dr. Eilers. Thanks again for joining us.
Thank you very much, Dr. Marinelli. I appreciate it.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.